Hello everyone, and welcome to this audio podcast. This audio podcast is part of the syndicate. This audio podcast is part of a Bostics syndicate. This audio podcast is part of a Storm and Saga analysis. This audio podcast is part of the Squallish series or edition, and this audio podcast is part of a Storm and the Bostics production. Today, looking at through this audio podcast, a look at renal and lifestyle medicine, renal and inner lifestyle medicine. To begin with, looking at some some barriers to modifying, or where barriers sort of hinder healthcare service users, in as part of this intro. So initially, literature informs that low health literacy is a barrier, and is a barrier. Secondly, a lack of quality context from healthcare professionals, a conflicts with cultural norms. In more recent times, and amongst in as part of literature, low digital literacy, and then in around implementing information in and from healthcare in and from healthcare, sort of underlying basis. So in as part of the adherence to in as part of lifestyle, in as part of renal and lifestyle medicine, adherence to healthy lifestyle behaviors or attitudes is therefore thought to be important or pivotal to preclude or prevent CKD incidences. Little evaluation at the time has a little evaluation has not sort of have not, or where evaluations have not highlighted the effects of lifestyle attitudes and behaviors and changes surrounding prevention and onset of CKD in context of long-term follow-up. Additionally, in as part of sort of in line to adherence. Literature varies, and until sort of more recently, there have not been sort of published works that actually look at the sort of duration of where for example physical activity, for example, is implemented or evidence. So in some literature, however, there is some consensus. For example, where literature informs that 60 minutes increase in sort of weekly sort of physical activity is associated with an annual EGFR reduction of in around 0.5% per year. High levels of physical activities and low levels of stagnation are related to a lower are related to sort of lower overall prevalences of CKD. Additionally, aerobic physical activity can improve function physiology and physiological functioning, and health-related quality of life, or HRQOL. In line to HRQOL, or health-related quality of life, there is QOL, or quality of life. CKD is associated with increased risk of morbidity and mortality, and has severe impact on QOL. QOL is an independent risk factor for mortality in CKD recipients, particularly in ESKD or ESRD. Low QOL has propagated sort of a major issues or problems in CKD recipients and current and their and in where QOL adverse a QOL where it is negatively implicated adversely impacts the sort of trajectory of the disease or the condition. Additionally, in around HRQOL, HRQOL specifically focuses on the impact of health status on quality of life. And ESRD or ESKD recipients show in amongst literature has been evidence where recipients show lower HRQOL scores than that of the general population. Low HRQOL scores in ESRD recipients are related to medical and socioeconomic status. Low HRQOL scores in ESKD or ESRD recipients are also associated with higher mortality and hospitalization rates. Additionally, HRQOL is affected by symptoms of CKD, side effects of pharmacotherapeutics, and its burden. HRQOL is has become sort of important as patient-centric healthcare is and has been sort of important as an indicator of has been an important indicator as part of healthcare and healthcare systems. The association between a low HRQOL score or scores and adverse outcomes is less known in CKD pre RRT or pre KRT recipient amongst pre KRT or pre RRT recipients, including in around mortality and CKD progression. In as part of interventions precluding CKD progression is a general priority in amongst medical and scientific literature for both clinicians and MD and multidisciplinary teams, so thus to reduce the requirement for RRT or KRT. Lifestyle sort of interventions that modify attitude and risk factors, such as in around physical activity and in around sort of long durations of stagnation, for example, and amongst life-threatening and precluding life-threatening complications. Life-threatening complications can improve the QOL QOL and prognosis or survival. And finally, as part of this audio podcast, to inform that there has been the KDOQI or KDOQI guidelines, which are guidelines that have been formed as a sort of a general consensus or guidelines around different aspects of kidney care or renal care. And in the KDOQI guideline, HRQOL is considered an important outcome, and is repeated, and it's repeated sort of recommendations to indicate best QOL, best sort of QOL is evidenced in amongst solid organ transplanted recipients, and in amongst RRT or KRT recipients. That draws this audio podcast to a close. This audio podcast as part of the syndicate. This audio podcast is part of a Bostic syndicate. This audio podcast is part of a Storm and Saga analysis. This audio podcast is part of the Squallish, and this audio podcast is part of a Storm Lobostics production.